Father, we thank you for the honor of serving our community. We thank you for your guidance, your support. We ask that you continue to guide us and lead us to make right and proper decisions. We hope that our board can provide the services that we so desperately want to for our community. In Christ's name we pray. Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God,
indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
May we see. Are there any citizen comments, Tom? Hearing no one respond, we have a consent agenda to approve and approve meeting dates from 7/28.
They are attached to your agendas for your review. Gary, do you have an agenda?
I left mine on my desk. It's okay, I
No, you have an agenda, right?
Make a motion to supplement from the last meeting of 1/28.
Okay, I have a motion by Griffin.
I second.
Do I have a second?
Second.
Second by Commissioner Young. All in favor, raise your right hand, please. Anyone opposed?
Yes, I didn't have to get through. Mary, do you need an agenda?
No.
Here's the. Are there any invoices for payment or anything like that? Be with? Not at this time? Okay. Now we'll go into our public hearing. The public hearing is for public comment, discussion on the district's fiscal year 2021 proposed budget, and possible action, if any, may follow. I'm open to any comments that anyone would like to make. Hearing no comments and no one asking for time to speak, I'm open if we do not have to act on this until September. But if we would like, we can go ahead and approve our budget. And I'm open for a motion on that.
Did we make some of those amended changes?
Not since the last one we approved,
Okay.
or we talked about last meeting. Do you need a copy of the share?
Okay.
Okay.
Just, we had changed a few,
We made some changes there,
Yeah.
and it was, they were reflected in the budget.
Okay.
Put online.
got it. Oh, I didn't print it, okay. I know Bill's worked a long time on this. We can hash up and down on all this information, but it looks like a solid budget to me. Unless anybody else has anything else. Motion to
The
accept.
first one, the beginning is where we start from.
Well, say that, yes, I did put in time, but all of you contributed to it. And Mary certainly had input to it. But there again, if there's anything anybody wants to change or whatever, now's the time to say it or whatever. Well, like I say, are you making that a motion, Sharon?
Can do some discussion and then I'm happy to make it out of motion.
Okay.
All I can say is we have money available for contingency operations. We're just getting started. There's going to be a lot of variables in it that we don't know. We've addressed this now for a couple of months. We've moved monies around to cover that. So, I don't know what else more we can do with our first budget.
I know, that's all right.
I think, 2 or 3 years down the road, we may see something different, but we've got money set aside. If we decide to do something in another location, we got money set aside to redo our building that we're going to get from the city, and so I think we've addressed all the issues I think that the Dow Volunteer Association would like to see get upgraded and stuff right when we get started. Some new facilities, so.
Okay.
I think it's a great starting place. I make the motion that we accept this budget, so we have started place.
I'll second that.
Okay. I have a motion and a second. Any further discussion? Okay. I'll call for a vote. All those who want to approve the budget as we're supposed to do for the 2021 fiscal year, raise your right hand for approval. Anyone opposed? It passes 5-0. Okay.
I prepared, real quick, if you don't mind, before you move to the next one, sir. I prepared the resolution. Both of these have to be done by resolution.
Okay.
Because as soon as y'all do this, we're going to put it on our site, and I also have to file a copy with the county. But here is the resolution for you to sign. It has the attached exhibit, which is the budget. That's it. That's the icing on it. That's the cherry on top of it. The budget can be amended if we have, we run into issues with it. It's a flexible document. It just has to be done, by board action. Mr. Secretary, if you don't mind getting the autographs and dating it, I put the date on it's 25th.
Okay. The next item we have is public commentary and discussion on the district's proposed tax rate. Possible action, if any, may follow. We had talked and posted that we were going to follow what the voters approved for us, which is the 10 cents per hundred. Is that correct?
Yes, it is.
And that's what we had discussed at the last meeting, and so now it's time for us to discuss it here at the hearing. Anyone have any comments or things they'd like to say about it? Hearing none, then I will go ahead and give you the opportunity, if you would like, to go ahead and vote on this resolution, make that our intention.
I make a motion that we accept and approve tonight 10 cents per 100 tax rate.
Second. I have a motion by Kowski, second by Griffin. Again, is there any discussion? All those to approve that resolution, raise your right hand, please. No opposed. Anyone opposed? So it's 5-0. sign over here.
That's another resolution for you to sign. As kind of a matter of housekeeping, I didn't think, the counties went to some new forms they gave me on this. You hear about entities offering discounts for homestead, for disabled vets, disabled homestead over 65, and et cetera, et cetera. We have to fill those out, and I put that we weren't going to do any, mostly because no one really is does it. Typically, the only one that gives you that right would be the county and the school districts, but none of the other ESDs do. Is that an issue with the board? Please, if you don't mind signing this too, I have to give that to the county. That basically is just kind of an informational sheet for the tax assessor collectors so they can start there to collect the taxes for them. I do have one other document I'll have to present to the by passing these tax rates. I'll have to present it to the president and the secretary. I don't believe it needs additional action. It's just an interlocal agreement with the tax assessor's office for them to collect these taxes for you. But they don't have them. Well, there's the cost, which we know because we've already budgeted, but it is an agreement that I will need you to sign. I just don't have it. Meeting with them next week.
Okay. So we've taken care of both of those items.
25, 20.
And I would like to thank the board and the volunteers for helping prepare this budget, because without you, it would have been very, very difficult to come up with anything. And you were able to work with it and do a job of sorting things out, and I really commend you for it, and I appreciate it greatly. Okay, now we're going to go into our regular scheduled meeting. Tonight, the first thing on the budget, on the agenda. Oh, okay, yes. Do I need to have a motion for that?
No, but no more further comments.
Okay, if there's no more further comments on the hearing, let's go ahead and have a motion to close it. Do I have a motion to close the?
I make a motion you close the public hearing.
Second.
Motion by Demmer, second by Commissioner Moore. All those in favor? Okay. Our hearing is closed. We've accomplished our task there. Now we'll move into the regular scheduled meeting. Tonight's first thing on the agenda is Dr. Courier was going to be here and visit with us about the medical director's position. I was told today that he could not be here today, but that he is available to us and will work with us as long as we want him to work with us. So I would suggest that we table this until we can have a visit with him. And get through this transition phase. And then we can look at whatever we want to do. That's just my general feeling.
Is he the only one we really want to talk about, or?
I think
For now?
it's my opinion that, we want to look and find the best one possible. But right now, we're in a transition period, and that's got to be taken. We've got to get through this transition thing.
Good to see us, big three.
They had him, is it okay to go from us? Did you hear me?
Okay.
Maybe we should add that. Ms. Dimmer had asked if we should add that, and
Right.
it says
Discussion.
All right.
That's what it was the introduction of discussion and possible action about him continuing for.
Okay.
So, And I'm not trying to be a open meetings act.
No, that's all discussion.
That's fine, I appreciate your.
I'll make a motion that we table, Dr. Darrell Courier, discussion possible action. Following meeting with a possible discussion action of other medical
Interesting.
directors.
Okay. We have a motion to table that item A,
I second.
second by Commissioner Denman. Any discussion? All right. All those in favor of tabling the item? 5-0. Sir. Okay.
Is the term for him medical director or is it medical control?
Medical director.
Medical director. Is that the same thing as medical control?
No.
No,
It's not.
I'm sorry. It's okay.
What's the difference?
One has, it just depends, because since he's an MD and we work under his license. So wherever we have the standard medical operating procedures that we fall under his license. So that's medical director. Medical control is totally different. It's kind of like my position. I kind of control stuff, do things. It just depends how you word it. But for him, it's medical director.
Okay. We'll move to item B, and Jim, I'm going to ask you to go ahead and introduce Mr. Talley. No introduction at all. Most of us probably know him, but I want you to.
Well, as we discussed, and I'll take my mask off for a minute, we discussed about 2 months ago, we talked about providing some form and insurance and all, and for our full-time, maybe some of our part-time employees. So I stopped by and saw Jason in his office. And he was very kind to sit there with me that day and gave us some ideas they're hanging. I think we turned it over to Mary, and Mary and I forget the lady's name. Yeah, got together, and Jason and I spoke last week about it. And I'm excited about this, I really am. I think this is something that we need to do. That would be beneficial for us and for our employees we're gonna have. And one of the things Jason pointed out, and I've seen it, obviously, business I'm in is opportunity. There's other things besides just the medical stuff that we can get into, and he's gonna talk about that tonight. So if, without further ado, I'd like to introduce Jason Talley from Talley.
Yeah, thank you. I'm gonna pass these out, and we'll just hold off real quick going through it. I want to kind of talk to you just a little bit about a few things and how we come up with some of this stuff. There you go. I have enough. There you go.
Well, if you have enough, John, Jason,
There you go.
Thanks.
All right. So I'm gonna hold this one if that's okay. Where's a good place you want me to stand?
Anywhere.
Wherever you want.
I'll just stand here if that's okay. Now, I hate to talk to your back.
Let's get it turned.
You good? Okay. Anyway, so let me just kind of tell you, when we look at a group like this, there's a couple of things that come into play. Of course, I know most everybody in the room. I appreciate the opportunity, number one, to be able to quote it. And of course, we know you have choices out there. But I'm an independent agent, and we represent a lot of different companies. And so when you approach quoting something like this, you simply have to get the data from Mary, which she provided us, you know, the people that are part of the plan, dates of birth, male, female, that kind of stuff. That's the census. And then, of course, the rates are based on your enrollment. Well, when you have a new group, it's a little hard to just pinpoint everything because you don't have a final enrollment. We know that eventually you might end up with 10 folks, I guess, but we don't know how many might be on the plan because they might actually have plans elsewhere. Maybe they have a spouse's plan, or maybe they fly for FedEx and they're going to wait forever. You know, I don't know. But anyway, the point is that we try our best to estimate what the rate would be, realizing that the final enrollment kind of dictates the rate. So I think what it comes down to is that when you evaluate the plans, you kind of have an idea, this is what our cost is going to be, realizing it could fluctuate. Once we get the final enrollment done, then we'll be able to say, look, here's your final cost, this is who's enrolled, and moving forward, that's locked in for the year. So if you actually enroll anybody else down the road, especially like on the medical or any of the other benefits, of course, those rates remain as is. And then, of course, the renewal will be 12 months down the road, and then that's when we go out and shop other plans, etc. Okay? So, I've been doing this for 24 years. We represent about 60 plus companies in the area, or we do some work with the county, and we're thankful for that. Other companies in the area. So that's kind of who we are and what we do. I was born and raised in Floresville. So the one thing that we pride ourselves on is, of course, service. So, we have an office downtown Floresville, so if anybody has questions, they can stop in and ask us, hey, we got a claim issue, etc. So I think local representation that has experience in this really makes a big difference, because we do get people stopping at the office on a regular basis. So that being said, I didn't want to bore you with tons of proposals, because every one of these proposals is about 50 pages long. What I try to do is take a look at the proposals and then actually narrow it down to some plans that might make sense. Because I don't know where you're at in terms of what deductible you want. I do know, just from my experience with other group cases, that of course we kind of know where certain deductibles fall and what's popular these days. So what it boiled down to, on these particular plans, we'll go ahead and go to the spreadsheet, is we quoted, of course, Aetna, United Healthcare, Humana, and then Blue Cross Blue Shield. I mean, really, that's kind of the four players in the small group market. When I say small group market, that's employee groups smaller than 50 lives, okay? And do y'all have a problem if I take the mask off back here? Okay. Because it's going to suffocate me, bringing all that carbon dioxide. Anyway, that would really help. Okay, so what we're going to do is I just want to look at, and I don't know when you have plans to make the decision. I mean, these quotes are illustrated for a 10/1 effective date. We don't know when that will be, but of course, if we move it to November 1, then we can easily do that. It's just, this is the starting point, okay? So what we have here on the first page are 4 plans with Blue Cross that make the most sense. Now, if you look to the right, the 2 columns on the right are Ppo Type Plans. That's simply plans that, as long as you go to providers that are part of the Blue Cross network, then of course they're covered, okay? So if you look at this one plan here, which is the 3rd column, you're going to see about a $3,000 deductible. The plan pays 70%, you pay 30% until you reach your max out of pocket. But it does have copays of $40, $80. Okay, so as we've seen in the recent years, the copay structures have really gone up over time. Years ago they might have been $15, $20, but you can see here that these copays are $40, $80. That just simply means if you go to a primary care doctor, it's $40. If you go to a specialist, it's $80. Okay, it has a prescription. What's that?
Out of network, folks. The 3rd column's out of network.
If you go in network.
Okay.
Okay, so now this particular plan has out of network, and we're not going to focus much on the out of network because Blue Cross has a huge presence in the South Texas area. Okay, so that simply means if you go to provider, a great penetration of our local providers, and of course San Antonio all over the place, Pleasanton, even south in Karnes County. The other thing I'll point out is that your lab and x-ray is going to be deductible and then co-insurance. That means that you're not going to have a copay that covers that, but you simply would apply it to your deductible before the plan pays. But what I will tell you, as long as you use labs like Quest and LabCorp, lab stuff is very inexpensive. Now, anytime you do go to hospital type services, then naturally that can be more expensive, meaning going to a hospital for those types of services. But if you do utilize those types of freestanding labs, it's less money. So that is one plan. If you look at the right plan, which is column 4, you see a $1,500 deductible. Then the plan pays 80%. You pay 20% until you reach that out-of-pocket of $6,000, but the copay is $30.60. Okay, so $30 for a primary care doctor, $60 for a specialist. And then you see what that cost is. So if you look at the bottom there, you see the employee cost, you see the employee spouse cost, employee children, employee family. So that's the cost, that's the gross cost, the total cost. If the emergency services district plans on paying that 100% or a certain percentage, it would be of the employee-only cost. So in column 3, that's $459.26. On column 4 on the right is $554.27 per month. So if you choose to pay 100% of that cost, that's what you're paying for. Then the employee then would pay for the spouse or children or family if they choose to put them on the plan. Okay? So then what I've done, and of course the challenge is always finding a plan that is affordable but has some good first dollar benefits for people. Because we all know we don't like paying for health insurance to realize that, you know, we pay all this out of pocket and never get much out of it. So I have looked at a couple of other plans on the left here, which are HMO type plans. Now I probably wouldn't recommend that they be offered solely on their own. But what we could do is we could offer one of those plans with one of the other plans and offer a dual option. So the employee could choose which plan they wanted to be on. Okay? So as you know, on an HMO plan, and they've kind of lost some popularity through the years, but Blue Cross still has a strong penetration of providers in the areas. So what that means is if you notice, see the cost is a whole lot less for the employee. And also really think about, you know, the families too, because, I mean, granted, any of these costs are very expensive, and I get that. Medical care has gotten very expensive, and we all know that. But, you know, when you look at the employee children rate, you know, you could actually have a person add their kids on the plan for a somewhat reasonable amount after that employee cost is paid. So that's something to think about, is we could offer a dual option where you provide that as a base, and then of course if an employee wanted to buy up, you could, or you could say, look folks, we're going to offer you both plans, whether you choose plan A or choose B, we'll pay 100% of the employee only cost. So that's one way that you could approach it. All right. Now, if you look at these columns, you're going to see that the deductibles are smaller. The co-pays are about the same, but you're going to notice that you don't have any out-of-network benefits. That just simply means that you have to stay in the Blue Cross Blue Shield network. You would have to have a referral if you wanted to see a specialist, okay? Whereas a PPO type plan, you don't have that requirement. And you have no out-of-network. So the only time you have coverage there is in the event that you have an emergency. So if you had an emergency, like an EMS treatment where you had an EMS run and you rushed to the hospital, or you had chest pains, difficulty breathing, bleeding, you know, anything that would constitute a prudent person feels like they're having an emergency, that would be covered in network, okay? So that's something to think about. Plus, if a person's out of state, it would also be covered if it was an emergency, okay? So you do have that protection there. Now, if you turn the page, we've got a couple of plans listed with United Healthcare. And so the Humana options, they just weren't very competitive. These plans are more competitive than what the Humana options were, and Aetna didn't really have anything competitive at all. So I just didn't even put them on there because frankly it's not something you would probably zoom in on because it's going to be more expensive. So United Healthcare, if you notice, our deductibles are a little bit higher. These are PPO type plans. They're not an HMO. Now if you notice the first one in the first column, see it has no out-of-network benefit, but it's not an HMO. That just simply means that we have a lower cost to that plan because we don't have an out-of-network benefit. That means that any provider that you go see has to be part of the United Healthcare network. Okay, but it's a PPO. You're free to go to any provider you choose on that network. 30/60 are the co-pays. So I was trying to get something with the co-pays that were a little more affordable. The plan pays 70%, you pay 30% until you reach that max out of pocket of $6,500. Now realizing that that max out of pocket includes that deductible too. Now, I'll give you an example. I know two different group cases where we have some specialty medications being taken right now are $20,000 a month. That's $240,000 a year. So you can take some medications on these plans and it just be really costly. Hospitalizations are ridiculously costly now. So I think we all understand that. And so when you have a plan and you have that card, I tell folks, even if you have a high deductible health plan and you have no copays whatsoever, that card is your ticket into good care. Because you can always negotiate that deductible with the hospital or the providers, but when you have that card that says United Healthcare or Blue Cross or Humana or any of them, that's your key to good health care. Because they know somebody's going to pay the bill, all right? And then, of course, the plan to the far right, the only difference there, you have out-of-network benefits on the right there. And then, of course, that makes the cost a little more expensive, but not a whole lot, okay? If you notice, like an emergency room is a $500 copay, then the plan pays 70%, you pay 30% until you reach the max out of pocket. So urgent care is $50. So if you have an urgent care visit to any urgent care provider, you would just pay $50 for that. So what we try to do in meetings where we do offer the medical plan is try to educate the folks on, you know, be sure you use the right facilities. If it's an emergency, that just can't be helped. But sometimes going to some of the freestanding ERs can be really costly to the plan, so we encourage you to try urgent care versus that. Anyway, so these are the plans that kind of stood out as being something that probably made the most sense, okay? In addition to that, and by the way, let me talk about the requirements on the health plan, is generally the requirement for the employer is 50% of the contribution, meaning on the employee, that the employer pay at least 50% of that, and 75% participation by the employee base. Now, let's say we have 10 folks that are hired here, and 7 get on the plan. Well, we're going to meet participation because if the 3 waive because they had other coverage, then of course they don't count. You know, so anybody that waives coverage because they have other coverage through a spouse, they don't count in the participation formula, okay? So that's kind of how that's handled there. So what we also try to do is when we quote the medical, we try to incorporate maybe a voluntary dental program, voluntary vision, some life insurance, all available because, you know, employers today make this available like a menu. Here are your options. You choose what you wish to take. We always try to put as many lines as we can together with the medical provider, whether it be Blue Cross or United Healthcare, whatever it is we choose. The challenge is with a small group, it gets a little more difficult because every one of them has different participation requirements, etc. So what I did is quoted the medical, but when you looked at the dental through Blue Cross and United Healthcare, it was more expensive. So what we did is we went to MetLife because MetLife, it tends to be a company, and we can look at Principal, and there's a few others too. But MetLife is a company that will provide dental, vision, other life coverages as well. Okay, so when you turn the page, you're going to see the MetLife quote. The other dental plans with Blue Cross and United were $32+, some were as high as $35 a month. So you notice what that cost is $27.28 a month, okay? And so what this plan is it's most of your dental plans are 100% preventative, 80% basic. Now, basic is going to be fillings, extractions, things like this, and then your major is 50%. So that's kind of a traditional dental plan. And then you have a cap every year of what the benefits are, either $1,500 or $2,000. This was a $1,500 benefit. Now, this is quoted employer paid. You can choose to pay it employer paid. That means that you only have to pay 50% of this cost to be employer paid. Or we can offer it on a voluntary basis too. It might go up $1 if we offered it on a voluntary basis, okay? But you can do that if you choose to just cover the medical versus other things, okay? If you turn the page, this is the vision plan. So vision, the 2 most common benefits outside the medical are dental and vision insurance. So a vision plan is simply going to provide benefits for eyeglasses, contacts, things like that. On the medical plan, ophthalmology is covered, meaning a medical doctor if you need treatment or surgery of the eye, but all your optometrists are going to be covered on a vision plan, okay? So for example, if you use a vision plan, you'll just pay a copay for your lenses, or for the exam it's $10. On this plan it's $25 for lenses and frames, and the frame allowance is $130. And it generally allows you to get frames sometimes every 12 months. This particular one's every 24 months. Now what I find, like with my glasses, my frames wear out, my lenses wear out before my frames do. So that's not a bad thing. We can also quote it to where you get it every 12 months as well. We do have a number of MetLife plans in the area where we have the vision benefits, and we don't really have challenges finding providers, so I think we have good coverage there. But I will tell you this, on a vision plan, it's best that you go with a provider that's part of the network. On dental, that's not so critical, because we have a lot of dentists in the area that may not take a certain plan, but guess what? You still have the out-of-network benefit that still pays reasonable and customary charges, which is 100%, 80%, or 50%, okay? But I would just tell folks, and we always communicate that to the employees when we have meetings as we go through these programs. That's the cost there. Once again, it could be easily offered as a voluntary benefit, and this was quoted as voluntary. Basic life insurance is another thing that most groups provide. It's a very inexpensive benefit. This particular one was quoted at $50,000, and the most common increments of basic life insurance are either $15,000, $25,000, or $50,000. I quoted the 50 because it's real simple to do the math. It shows you there that it's $825 per employee. If we did $25,000, it's just half of that cost. Okay, so at least this gives you an idea of what the range would be. And if you wanted 25, we'll just revise it to simply give you 25 to show you what that cost is, but it'd be half that cost, okay? Now the basic life insurance, we always quote it to include accidental death and dismemberment, which means if an accidental death occurs, it's a total of $100,000 versus the 50. Or if they had 25, it would be 50 accidental death, okay? Now, for the total amount of employee population, if you had 10, it'd be $82.50 a month doing the $50,000. So that's just something you can decide. In addition to that, we always offer supplemental life insurance, because we all know that a number of us might pick up the phone and call an agent and say, hey, I want some life insurance quotes, or they might do it online, but sometimes we don't. This offers employees the opportunity to purchase some life insurance in the workplace and do it on a payroll deducted basis. Now, where the tricky part is the guarantee issue is based on a certain number of employees enrolling. If we don't get the 50,000 guaranteed issue, it's going to be at least 25. But you do get some form of guarantee issue when you offer it on a group basis to the employees. If it's not guaranteed issue, then there's just a few health questions that get completed. We turn it in, it goes to underwriting, and then once it's issued, then we get that to payroll and let them know, okay, Mary, it's been issued, you can start deducting this out of the paycheck. But we don't take those deductions until that's finally issued, okay? We try to make enrollment as simple as possible for employees. What we try to do is, and I should have bought a form to show you, we use one form if we're going to use a form. And that form is simply name, address, here's the plan, whatever Blue Cross plan or United Healthcare it is, and to the right it's going to show what your cost is. So if y'all are paying 100% of the employee-only cost, it's going to show 0 for that employee. But then it's going to give them the cost for their dependents. And then we go to basic life insurance. If that cost is paid for by the group, then it's going to show 0 cost to the employee. Anything though that costs something, it's going to show their cost, and then they just simply check boxes what they wish to elect and sign on the back. So we put all the proper authorizations on the back of the form. which simply gives you permission as the employer to deduct this out of their paycheck for this benefit. It also allows any deductions that qualify to come out of their paycheck on a pre-tax basis. So one of the things that we provide you is a Section 125 document. We cover the cost of that. It's very minimal, but I have a service I use for that. That's just simply an IRS document that says you as an employer can deduct this out of their paycheck on a pre-tax basis. And if you were ever audited by the IRS, then you have that official document that allows you to do that. Then on the employees' forms that are filled out, it discloses that. And what it simply says is that you must keep this election for a year, because that's the one stipulation of the IRS, and then only make changes at open enrollment. Now, but if you do have a marriage or the birth of a child or anything like that, you can make changes, of course, within 30 days of those events, okay? So, but we include that as part of the deal too. A lot of our cases, we've gone electronic enrollment. A case size like this is probably not necessary because we provide a packet for all the employees. So what they're going to get in this packet is they'll have the price sheet of the cost, and then in the packet it will have the medical plan summaries, the dental summaries, all the detailed summaries provided by the insurance company in that packet. The other thing that we do for companies in our area is if there's a new hire, you just let us know when they were hired and what effective date they'll be, and we come out and we meet with the folks. Or we can meet them at our office, either way. And we just sit down with them and explain to them the benefits. That way, they're not having to call an 800 number and handle it that way. And I think that that's very important because people understand the value of benefits when something's really explained to them. And so that's something we do on a regular basis. Now, let's talk just briefly about waiting periods, because when you have a new hire, there are several ways to set things up where you can't exceed more than 90 days. When Obamacare was passed, that was one of the stipulations. You can't exceed more than 90 days. You have to offer the benefits up at least till the 90th day. You can't exceed that. In other words, they can't wait past that period. So most employer groups are on a 60-day wait first of the month following. Some groups have it sooner than that. It's your choice. You can make a person effective the first of the month following hire, 30 days following hire, or first of the month after 60 days. So that's how we would set up any type of waiting period. So what we try to do is if we're notified of that new hire, we know when they're going to be eligible for the benefits, and we come out probably at least 30 days in advance and meet with that person, get them enrolled, and then that way they get their ID cards and everything ready to roll when they're really effective on the plan. And so that's how we handle that. So
This would be, we can do it for volunteers too. I mean, not just our permanent hires, we can do it for volunteers, for volunteer people too. We can put on.
well, typically, most of the stipulations, you got more flexibility on the voluntary benefits, but on the health plan, they stipulate work hours.
Okay.
So, you know, that would be 30 hours a week, you know, if they're working full-time for that employer. But on the voluntary stuff, we can be sure that we incorporate some of those things. You have a lot more flexibility on that. But it might be a little tough on the medical plan. And here's where the challenge might be, is if we ever have a major claim and there's an audit and they want to see payroll records, then I wouldn't want to be on that end of a claim being denied, you know, because of that. So, but on the voluntary items, we can always work through some of those things. At least offer something,
Okay.
you know, and give them an opportunity to have it on a through a paycheck, you know. So anyway, what are the plans? I know we haven't talked about what you think about the effective date, but what were y'all trying to anticipate?
Well, by the time we get the hires and everything, I would think probably December.
Yeah.
We start one October, so it'd be December.
Yeah. So what would really probably be a good way to do this is after this meeting, or y'all take some time to talk about some different things, but maybe Mary and maybe one board member or two not to where you don't have a quorum, of course, but to where you can sit down and say, okay, here's some options. This is what I think we ought to consider doing. And then when all that is done, then you present it to the board for the final approval, and we're good to go. Because, you know, in this kind of setting, it kind of gets a little difficult sometimes to really review plans, etc. You know, but I'd like to give you a little time, and then maybe y'all provide me some feedback, and then that way I can really put together some additional options, or if you like this idea versus that, then I need to know about it. Because, like for example, do you want to fund dental, do you not? Do you want to fund the medical 100% or not? You know, so those kind of things will be very helpful for me to kind of drill down on the plans and get you the best deal possible. You know, so that would be my recommendation. You know, tonight I wanted to just give you some ideas. This is kind of what you're seeing as cost. Here's some things that can be done. And you know, you got to be careful of doing too much at one time sometimes. Sometimes keeping it simple is a good thing. But these are things that we do for all size cases on a regular basis. It's just any more the norm with any of our cases that we handle. We offer all these benefits to them, just because people like the idea of being able to buy things on a voluntary basis. Okay?
Anyone have any questions?
So
Thanks, Dave.
I have a question about the Blue Cross prescription, page 1. Is that zero dropped out of like 250, or do they have no coverage for prescription?
No, what that means is, well, you don't have an additional deductible, so to speak, for that RX, and that sometimes some plans will have an additional RX deductible. What that zero, that first zero means is zero for some generics. There's some generics that are so low cost that you don't even have to pay for them. And then
It just looked like it wouldn't cover anything.
no. So what you're going to be looking at here are these copays where it says 10. That's probably going to be 10 for your higher cost generics.
Okay.
And then when you get into 50, then you're starting to get into brand name type medications, you know, and so that's what that means.
Okay.
But the zero below it doesn't mean no coverage.
Okay. That's like.
Yeah. So anyway, but that's basically what that means. And then of course, what that means over there on the far right, when you say see 50 over here, that just simply means if you went to an out-of-network pharmacy, you're going to have a small deductible before the plan starts paying. But really, we don't have an issue with that because all your major pharmacies in this county are on the plan. You know, so that rarely comes into play. And the other thing I would suggest, if any of you have any questions after a meeting, you know, just call me. I've left my information in here, and you know, I'll be glad to answer any questions you have. And but I would just recommend that maybe a couple of board members to simply sit down and say, okay, here's what we got, and then it makes it easier for the rest of the board to say, hey, I like these options, let's move forward.
I think a very time to the new hires, everything to sit down and tell them when it's going to be available and what it's working out.
Yeah.
Look at December.
So I think I've covered most all the bases. You know, just realize that there's certain voluntary plans that have certain participation requirements, but very seldom we have issues with that, and we're able to work through all that. Okay.
When we talk about the additional plans like the life insurance one, we'd be able to offer that to everybody, including the volunteers.
Yes. Now, when you say volunteers, are they actually working any amount of hours and they get paid at all?
Your lowest volunteer works how many hours?
24.
I'm sorry?
24.
24 a month, a week?
They'll do a 48 a month.
48 a month.
But they get paid for that work? Or?
Yes.
Okay,
Yeah.
It's a stipend.
Yeah.
I'm just kind of used to hearing volunteer.
No, they're volunteers, but they get paid.
Yeah.
But they're not, so that would be something that we could offer or look at as a board,
Yeah.
to offer our volunteers, to say, hey, we'll pay this for our volunteers after a certain period of time. At least give them life insurance and whatever, you know, dental or what else we can get.
Right. So once again, we did get some quotes from UHC and Blue Cross on the voluntary options. MetLife, of course, is something that we offer with a number of cases, and they've always been a good, solid choice. What I like about them is when we have a claim that they get the claim paid. And they're a big company. Of course, some of the other companies we think of is like Principal Financial. They're also another good company, Lincoln, etc. But they're all going to be within a few cents of each other. It's not like it's a huge difference, but I'll be glad to even spreadsheet more options. I just really probably want to get a feel from you guys, where we want to go, and then we'll go from there.
Well, Jason, thank you very, very much.
You bet.
I got one other question. Blue Cross Blue Shield or United Healthcare, which one's the easiest to work with?
Well,
What's your expertise?
that's a good question. They're all a pain at times. I really don't have an issue with either one of them. We've got a lot of Blue Cross cases, a lot of United Healthcare cases. I will just tell you, with any problem you ever have, unfortunately, the insurance company gets blamed. So, for example, most of the issues we find, it usually comes down to a coding issue, that the claim was submitted and it wasn't coded right. But what's going to happen is the folks are going to usually say, well, that Blue Cross, they denied my claim, I can't believe them. But yet, that's why we're here, because if something comes up, we want people to pick up the phone, call us and say, something doesn't look right on this thing. I've never had, in 24 years, had a challenge where a company has flat denied something we never got it paid. Well, let me just correct that statement. One time, and that was a special device that cost a whole lot of money for an autoimmune disease. And, we went through some challenges there, but it was not your typical day-to-day kind of claim stuff, okay? So, I would say both of those are still great companies to work with. And, I don't have trouble with either one of them.
That new office over there by, the lumber company, is that WellMed? That's not
No.
Blue Cross or United Healthcare?
No,
You
that's
mean-
mostly Medicare.
Oh,
Yeah, WellMed is mainly a Medicare provider.
okay. Okay, got it. No, I'm not that old. yet.
About years of transfer, we talked about, we said on the first month we formed, we talked about hire local, keep the local, bring the local people in to get the service. I think Jason just presented a really good case that we can really take care of our folks and give them something. that they
Yeah,
haven't done.
and let me just mention this too. Maybe some of you in the room know some of the companies we deal with, but I'll just mention two public entities we deal with, and we've done the employee benefits for Colony Memorial Medical for probably 15 years, and we do all their retirement planning, the whole 9 yards. So we've done that for quite some time, and then we do a lot of work for Floresville ISD as well. And I mentioned them, of course, they're public entities. We do some work with Wilson County, and we're appreciative of that. So, anyway, thank you so much, and y'all have a great day.
Jason, thank you very much.